Hey, everybody. Welcome to this latest workshop from the Africa-China Reporting Project on reporting the COVID-19 pandemic and Africa-China relations. My name is Eric Olander. I am the managing editor and co-founder of the China Africa Project website and podcast. You can find out all the information that we do at chinaafricaproject.com. And today we're going to be talking about how to report the pandemic. And we've got an amazing group of journalists from across sub-Saharan Africa, really to provide you practical insights and tips from their experiences in covering this crisis. Now, it's interesting because last year, around this time, in fact, we did a similar workshop with the Africa-China Reporting Project, and we brought together a whole bunch of journalists, same kind of format that we're doing today. And we were talking about COVID-19, but last year, it was still a relatively new thing. Last year, Africa had not been that impacted by the medical aspect of COVID-19. It was largely an economic story. The infection rates were still relatively low, the death rates were still relatively low, and the virus had not made its way onto the continent. Now, fast forward to where we are today, there have been at least 6 million reported infections, 152,000 reported deaths so far this year alone. And we're only halfway through the year. We're seeing the pandemic in certain countries really have an impact, both in terms of public health and obviously in terms of the economy. Let's take a quick look at some of the numbers as to where we are today. The number one country for both infections and deaths right now in the pandemic's most serious kind of center point is South Africa, 18,767 infections and 334 deaths. Tunisia, Zimbabwe, Zambia, and Libya round out the top 5 for infections. And in terms of deaths, it's Tunisia, Zambia, Namibia, and Zimbabwe. Now, for journalists, this has really created all sorts of difficulties because this is a profession that depends on going out and finding the stories and talking to people and interacting with people. And when we can't do that, what happens? Or when it becomes too dangerous to do that, how do you continue to get news and information out? Especially because in many African countries, just like in countries around the world, not only is there an epidemic that is health-driven, there's also an epidemic of fake news, misinformation, bad information, partial information, all mixed in with good information. And it becomes incredibly difficult for the audience, the readers, and the news consumer to figure out what's real, what's legitimate. So that's in part what we also want to talk today about, is how are journalists in Africa doing their jobs, confronting the challenges of misinformation, fake news, and all of the social media rumors that are just going so fast. So we've got a fantastic panel, and I was telling the panel before we started that I think that most webinars are just dreadfully boring. And we're gonna really try to make this session really as lively and dynamic as possible. First, we've got, again, a great group of journalists who are gonna be very engaging. Secondly, I want to invite our attendees that you guys can start putting questions and comments into the chat right away. Consider this to be your session. This is really, we want you to focus on issues and information that will help you become better, especially if you're a student. This is a great opportunity to engage some great journalists. So let's start with a quick rundown. We've got Lilian Mukoche from Kenya. We also have Justin Nwafor from Nigeria, Isidore Abah from Cameroon, and Nina Mitch from the Democratic Republic of Congo. Before we get started into our topic discussion, let's go one by one to introduce our panel so that they can tell us a little bit about who they are and what they're reporting and some of the issues that they're confronting. Isidore, let's start with you to talk about, a little bit about yourself. Just help us get to know you. Isidore, can you hear me okay?
Okay, I can get you now. Thank you very much. I'm Isidore Abah. I'm from Cameroon. Precisely, I'm based in Buea in the Southwest region, one of the regions that is experiencing an armed conflict. And I was former editor of the Post newspaper, and currently I'm a freelance journalist and working with the church.
So Isidore, we're going to talk
I'm
to you
interested
about
in
not
health
only
reporting, and I also do investigative journalist.
Okay, so Isidore, we're going to ask you questions not only about confronting the pandemic, but also dealing with conflict as well, because both of those are difficult challenges to overcome. Let's go to Nina. And Nina, hello, and tell us a little bit about yourself.
Hello, my name is Gabrielle Nina Mitch. I'm from the Democratic Republic of Congo. I am currently based in Lubumbashi, but when I was on this project, I was in Kinshasa. I mean, when the coronavirus started here in the country, I was in the capital city. So I publish my stories for different local and international media. I mostly write on health, politics, and climate change. Yeah.
Okay. Lilian, let's go to you now.
Okay, hi everyone. Glad to meet you. Lilian Mukoche here. I'm from Kenya, specifically the western part of Kenya, Kakamega County. Presently, I work for a university radio station, which is a learning and community radio. It's Most FM. I'm a radio producer and presenter. And I also do publications. I do online publications, that is for Talk Africa, which is for freelance journalists in Kenya. And I'll also do for World Pulse, which is a platform for that focuses mostly on women raising their voices. And I do so much on climate change, the environment, and health. And recently, I'm focused so much on COVID-19 since it struck in March 2020. And I've done a lot since I got engaged with Africa-China reporting project. Yeah, and I'm glad to be here today.
Wonderful. Well, it's great to have you with us today. And we're going to talk to you about radio and how you cover this, and then also digital. So if you have questions for Nina and also for Lilian about different ways of reporting the story, we've got two kinds of journalists here. Justice, let's go to you now and tell us a little bit about yourself up there in Nigeria.
Hi everyone, my name is Justice Nwafor. I write for Nigerian Tribune newspaper, and I also freelance for a number of media organizations here in Nigeria. Basically, my reports focus on health, most recently health, and then I have also written much about oil and gas, the oil and gas sector in Nigeria. I am from the southeastern part of the country, but basically right now I am based in the southwest. Yeah.
Okay.
Thank you.
Okay. Well, let's get started into, again, the nuts and bolts of covering this story. As I mentioned in the beginning, a year ago, this wasn't really that big of a story. Infection rates were quite low, and we talked a lot about it, but they hadn't started the big lockdowns like we're seeing in places like in South Africa and like what you had in Kenya. But today the situation is very, very different. Nina, let's start with you in the Democratic Republic of Congo, because on a good day in the Democratic Republic of Congo, governance is always difficult. Life is not easy. Things don't always work the way they should. How has the pandemic changed the way that you do your job every day, on top of some of the challenges that you have to overcome, just because the Congo sometimes is a very unpredictable place?
Sure, it is really an unpredictable place because, when you are a journalist, especially as a freelancer, we really come across, not come across, but we really go through so many situations, like get sources when you want to have an interview with an official, when you have to write stories, especially a story, well, I mean, in which the government is really involved, like the management of COVID-19. It is really a sensitive topic here in Congo. So when you get to talk to an official, you really get to explain in details what you really want to write on and for which publication you want to write the stories. And by the time you say, for example, you want to write for a local publication, you won't have really, chance to get access, the source locally here. But when you say, for example, you want to write a story for an international publication, an international media outlet, the doors will be really open for you. So the most challenges that journalists face here in Congo is getting, sources and also data, because with COVID,
has that gotten more difficult because of COVID in terms of people being even more reluctant to see you in person because they're afraid of infection, or is COVID not affected that too much?
It didn't change anything. It didn't change anything because, as for me, I started working on Ebola, for example. I wrote stories on Ebola, and it was the same situation, like having, the people that are allowed to talk, or to speak on the mic, or to give some statistics about the situation going on, or about, the health situation of the country. Even the minister is not really accessible. You can't just access the minister just like this. Even his cabinet, you just can't. It's really difficult. Getting sources here in Congo when it's about something really public, because health is something which is really public, and you need to get the real source, not just everything. You need to get the real statistics from the people that are really authorized to speak on that situation.
Justice, does anything that Nina is talking about in terms of the difficulty of getting sources or the preference for dealing with international media rather than domestic media, does that resonate with you in Nigeria?
Okay, really, when she was talking, I was smiling here because it is almost the same thing here in Nigeria. I'll give you an example. Recently, I did a report on TB, tuberculosis, and the intersection of the restrictions to movement and lockdown and how it affected TB patients during the lockdown. You find out that when I got to the field, when I was speaking to people, like I had my face cover on, people were literally running from me. People were literally running from me. Even the TB patients were literally running from me. That's one aspect. The aspect of access to data, I had to follow up with government officials who should ordinarily make data available on the public portal. I had to follow up on them every time, almost for 1 month. I had to follow up on them before they were able to release the data. So access to data, I think it's a big issue for us here, not just in Nigeria. I'm sure across Africa. And then the other very, very important issue she mentioned is the preference for foreign media organizations. Of course, if I introduce myself as a reporter from Al Jazeera or CNN, even the minister would want to speak to me. That's injustice. That is.
But if you say you're Premium Times or the Daily Sun, they go, forget it. We don't want to talk to you.
Yeah, really. When you introduce yourself as a local journalist, they were like, okay. And especially when they see your profile, like, okay, you've done some investigative reports that in the past really embarrassed them, they'll definitely not talk to you.
Okay, so let's get practical now. Both you and Nina have identified a key problem in terms of getting data and getting sources. Yeah. Tell us very quickly, what do you do to overcome that? And then I'd like to hear from others as well, because we want practical solutions, because I'm sure that people watching this are facing exactly the same problem. Justice, how do you overcome that challenge?
I don't stop. I don't stop. I'll keep, and at a point it will become embarrassing to them, and then they'll have no choice. Really, I don't stop. I'll keep asking them, and they wouldn't have any choice. And then another aspect is I make use of my sources. Most times when you go straight and they wouldn't really talk to you, if you have inside sources, they will really help. Inside sources have really helped me. So I don't stop. I keep asking them until they get embarrassed and then release the data to me.
Okay, Lilian, you've been smiling. You're in the radio, you're in the studio, so you don't get out there the same way that the print journalists and others do. But how much of what you're hearing here resonates with you?
Yes, as much as I'm in radio, I also do online. And online, you need to go out there to do research. And going out there to do research, you need to get this data. Even if you are in radio, you need to get this data. You need to get the experts maybe to come to the studio for you to get to interview them, to get to know what is really happening. But in our country now, in our setup, they have designated in a way that we only get information regarding COVID-19. The only person who is mandated to give us the information regarding numbers and all that is the CS from the ministry. At the county government level, you cannot say you will use that data to do a story because they'll say the information is wrong. You have to get that information from the national office. Now, it's been a very big challenge, but just as the guy from Nigeria says, you keep on pestering and you have to have the inside sources. They will help you. And then again, for us, people of, they call us community radio. In Kenya, they regard it as, we have mainstream media. They call themselves mainstream media because they broadcast for NTV, like NTV, Citizen, or from other countries. Now, when you go to the field, they want to give preference to those media houses rather than those from the community. So what you do, you have to have links. You have to have networks, right, with these guys who work for other stations, so that when you don't have a chance of getting that information, that your network will help you to get that information so that you can be able to report factually.
Okay, yeah. Lilian, that sounds great. And I've been reporting for 35 years. I've got a really good network. You've been reporting for a while, so you've got a good network. But if you are a 21 or 22-year-old university student, you are new into the industry, you don't have a big network, you're just starting out, what advice do you have for them?
Yeah, you have to pester and do your research. You don't go to the field when you don't have something at hand. You have to do your research very well and just continue knocking. If you go to an office, they don't give you the information. Don't stop at that. Continue looking for that information. At the end, they'll give up and just give you the information for you to be able to do that story.
Okay.
Yeah.
Okay. So Isidore, you're at the end of the line in terms of this conversation and this topic. You've heard from your colleagues on the panel about some of the difficulties they've been facing. You face the added challenge of living in a country that is racked by a conflict, and particularly in the North, Anglophone, Francophone communities are at odds with one another. COVID-19 is a problem that you have. And like in the Democratic Republic of Congo, reporting in Cameroon is not easy on a normal day. And now all of a sudden you've got all these extra factors. Talk to us about what you've heard today from your panelists, and then also some of the challenges you've encountered from reporting in the COVID-19 era.
Thank you very much. I think when they were speaking, Nina Justice, Lilian, I was just smiling because it seems as if we have a perennial problem of access to information. And in my own context, where I am in a region that is going through an armed conflict, I had to go to other regions that are not really related to the conflict. But each time you go and you're seeking information, they look at you as a spy. It's pretty difficult, especially if you introduce yourself that you're working for a private media station. Access to information becomes very, very difficult. And within the context of COVID-19, at first here, people did not actually believe in it. I'm speaking in terms of the Northwest and Southwest region. People just thought that it was a ploy by the government to fleece money from international partners and donors to fund the war in the Anglophone regions. So if you even move up to somebody and talk to him about COVID, he say, what is COVID? We don't have COVID in Cameroon. There's nothing like COVID. They are just using this to fund the war. What are you talking about COVID? And then I had my own task was a little tedious because I had to do a story on a sector that is not very open in prison. First, getting access to that prison was difficult. Even if you meet the superintendent of a particular prison, he will refer you go to the central government. And if even I got to a stage where I wrote repeatedly to the
Oh, it looks like we might have lost his bandwidth. Okay, we will get back with Isidore. Oh, Isidore, are you back with us? We lost your audio there for a little bit, but let's. Okay, we'll get back. Hey, Justice, let's come to you very quickly, because one of the things that Isidore said, which was very interesting, was how the government and how different people didn't believe early on that COVID was a real thing. This has been a chronic problem in Nigeria, where fake news, misinformation, lots of partial information has been endemic. It's been an issue that the government has used in part as the reason why they shut down Twitter as well. So they've taken real action on it. So in one part, the government has taken advantage of this situation, but it's also made it very difficult for journalists who are trying to figure out what's what. Talk to us about how fake information and misinformation have impacted the situation in Nigeria.
Okay, thank you. Actually, in Nigeria, fake news is a huge problem. It's a very big problem in this country. Of course, every day you see WhatsApp messages circulating, telling you that when you take the vaccine, the coronavirus vaccine, you will die the following day, and a whole lot of misinformation is going on here. But then, yes, it has really impacted. It has doubled our job. It has doubled our job, even unconventionally. Like personally, right now, in the groups I belong to on WhatsApp and Facebook, once anybody puts any information I know that is wrong, I will immediately counter the person, and then educate people in that group. And then when we link it to the ban of Twitter in the country, Twitter personally, I use Twitter a lot in my research. But since the ban, it really has reduced the rate of information we get from Twitter, and then it has robbed some people of the opportunity to get adequate information, accurate information on Twitter. Most of us, when we do our stories, we share on Twitter. Our platforms we share on Twitter, and then since this ban came in place, people have been denied the opportunity to get accurate information from that. So basically, yeah, it's a huge problem in this country. It's a huge problem, but we are doing our very best. We are running fact checks programs. We are using different platforms, social media platforms, to debunk what we know as fake news.
And so, Lilian, since you work with students in Kenya on, what do you tell them about this challenge that we're hearing from the rest of the panel and that you yourself have confronted in terms of getting access to good data and how to counteract misinformation and fake news? What do you tell students about that?
Okay, most of the time they go through trainings, as it's good for students to do their research, and there are sites that they can visit. We can say when they can Google, they can go to sites that are genuine for them to get the information, especially government sites where they can get the information. And then the matter of fake news, actually it's rampant. And given that COVID-19 struck and no one knew about COVID-19, what it is, everyone knew about the virus. So a lot of information is out there that is making each and every person think that the government just wants to use this to fleece money or to get money from the donors. But Basically, what we tell the students that to do their research, to make sure that they go to sites to ascertain if the information is right or not. And this is through trainings. Actually, the Department of Journalism has made sure that students go through various trainings, be it formal, be it non-formal, to make sure that whenever they are doing their reporting, they are reporting factually. Yes.
Okay, that's very interesting. We've got a question that I want to put to you guys, and I also want to, again, invite everybody who's attending that this is a great opportunity. Don't be shy. If you don't want your name to be used, that's okay. Just put a question in the chat, and I'll go ahead and put it to the panel. But our first question comes from Cassian in the Democratic Republic of the Congo. So Nina, I'm going to come to you with this one. Cassian writes, how can a reporter handle on-the-ground work in terms of interviewing and collecting information where people are suffering from COVID-19 infections and where the rate of infection is very high? What advice do you have for Cassian on that?
Come again, please. I didn't get the question.
Sure. The question basically is, how can a reporter do their job on the ground by interviewing people and collecting information in places where the COVID-19 infections are very high and where it's potentially very dangerous? What do you recommend?
Okay, so I personally wear a mask. Yes, that's really mandatory. I wear a mask when I'm going.
How common in Lubumbashi is wearing a mask? Do a lot of people wear masks in Lubumbashi?
No, they don't. They don't wear a mask here. They don't really wear.
Does that scare people then when you wear a mask?
Sorry?
Does it scare people? Because we heard earlier that when you wear a mask, they go running. When you show up with a mask and nobody else is wearing a mask, does that create a barrier between you and the people you're trying to talk to?
Naturally, because when you want to get in a shop, for example, wearing a mask is really mandatory. So you need to wear a mask before getting in a shop or an office or a bank and whatsoever. But people don't really have the habit of wearing a mask here in Lubumbashi. Why? Because coronavirus didn't really start here in Lubumbashi. It started in Kinshasa. So when it started in Kinshasa, people from Lubumbashi didn't believe in that at all. The first cases, for example, when the first cases was reported in Kinshasa, here in Lubumbashi, people, were like, is this true? Maybe they just want to report the same things that other countries are reporting. So they didn't really believe, from the first, case. And I personally, when I go in the field, I wear a mask. And yes, it is true that I do radio reports, TV, and also online. And I know I have my microphone, but I don't really have, that's, on TV with CNN journalists and other France 24 journalists. They have this microphone that they just like yours. We don't have those kind of materials, but I use my microphone, wearing a mask, and also trying to be a bit, far from the interviewer. So that's how I do when I have to do interviews in the field.
Okay. Well, you did a story, and each of you did a report for the Africa-China Reporting Project as part of the grant. And I'd like to kind of hear a little bit about your findings from this report. Nina, we'll stay with you in the DRC. You did a story on the spike in COVID cases and how that pushed the DRC to seek help from China. What did you find in your reporting in the role of China in helping to mitigate or not the COVID-19 pandemic in Congo?
So China, really participated in the first wave of coronavirus. I remember it was between May and April. They came to Kinshasa to support the response team and also some hospitals that were receiving positive cases. They just came and they didn't even, spend lots of time in the field. In Kinshasa, when I was in Kinshasa, I had to go to the mayor's office where there is a meeting, but we couldn't even talk to them. But the representative, the consulate, who is affected, I mean, who is in Kinshasa, could just report what they could, you know, talk in a meeting and report to the journalists. Yes, but what I find out is that Chinese really participated in the first wave of coronavirus, and after that they didn't. But the government still rely on the donation from other partners like Chinese. As you know, Congo and China, they have these business partnerships. I mean, for a long time, and they still work in partnerships. But since the vaccine is now available, that was after my story, been published. So they haven't donated anything yet so far, like the vaccines we have here, AstraZeneca that came from India, but the Chinese, they haven't done anything yet so far.
And
So
have the Chinese,
we
do you
hope
think,
that
done more or less or the same as other development partners, say the European Union, United States, or the UK?
The Chinese, they were really, as I said, they were really present in the first wave of coronavirus. The second wave, the European, yes, they donated a donation to the government to support the response team. The US, no, I haven't heard anything yet from them, and also the UK. I don't know, maybe it's something which is happening internally and they don't want to publish it, maybe, but so far
Not
we
much.
know that Chinese really participate in the first wave and the European Union in the second wave. Yes, so that is how it is going.
Okay, so Isidore, hopefully your audio is back with us again. For your story that you did with your grant from ACRP, you also talked about the Chinese medical aid and what they did specifically in prisons. Talk to us a little bit about the findings from your reporting. You got to turn on your microphone. Okay, Isidore, there we go.
Okay, thank you. I think the Chinese, they stepped in, specifically Jack Ma, the business magnate. He was the first person who donated to the Cameroon government. And his donation came at a time when many people have started seeing the effect, and the number of cases, positive cases, were soaring. And the government had not taken any measures to curb it. And there was nothing. People were depending on rudimentary things. They thought that only washing your hands could do that. But Jack Ma donated face masks and other anti-COVID-19 kits, which many of what he donated were used by health workers. When the government was receiving these kits, they say, okay, we're going to send some to prison. But it came at a time when even healthcare workers did not have these kits. So they were more exposed to people who were suffering from COVID-19, who were suffering from the virus, because they have day-to-day meeting. They were interacting with these people on a daily basis. So part of this were used by healthcare workers, and just a small fraction was sent to prison, and mostly in prison in the central region. Remember that at a particular time, the inmate had to go on riot because many of them were dying and nothing was forthcoming. So when this medical aid came in from the Chinese, it actually helped to assuage these number of COVID-19 patients, because they took hand sanitizers, face masks to prisons, and from there, prisoners started using these things. But we think that the Chinese played a very pivotal role, and they are still playing it even now with the vaccines, because when the government of Cameroon actually ordered for the AstraZeneca vaccine, with the misinformation and the stigma that came with it, many Cameroonians were reticent to taking it. So it was again the Chinese that came in now with the Sinopharm vaccine and gave about 36,000 doses, which was the first wave, the first consignment of vaccine that the government had to use. I think that even till date, the Chinese are still playing a very pivotal role in the fight against the virus, because besides the kits, they also donated ambulances, especially to hospitals in the Northwest and Southwest that are experiencing the crisis. So the medical aid was really very timely to even these hospitals and
okay, but you know, to date, the Chinese, I'm looking at the Africa breakdown of where the vaccines have gone. Cameroon's only received 200,000 doses of vaccine from China. Compare that to, say, Morocco, which has gotten 10.5 million. So you said that China's done quite a bit, but since the Jack Ma donations and only 200,000 for a country as large as Cameroon, is that significant? I mean, it doesn't seem like very much to me.
Yeah, it's grossly insignificant because, like I said, it's changing the stereotype because, like I told you at the beginning, people don't even believe in it. Why are people reticent to take this? They think that it's government ploy. Remember that when the crisis started, the World Bank made available 1.3 billion francs as a means to cushion the effect, the economic effect this was having on the population and the economy that was battling for so many crises: Boko Haram in the north, the Anglophone crisis in the Northwest and Southwest, the post-2018 presidential election, and the incursion of the Seleka rebels in the East. So the World Bank, the IMF thought it wise that it would be important to cushion this effect of the virus was having on the economy, and they disbursed 1.3 billion francs to the government to help it really fight the virus. But paradoxically, from what journalists are gathering, some ministers sat in their offices and shared out this money. And then there was a time now they applied for a loan of about 180 billion. And this is what this money was disbursed, and this money has been used in a way that people cannot account for. And today in Cameroon, we have what we call the COVID gate. So the manner in which government managed these sums of money, which they collected from partners and international monetary bodies, has made people to even lose faith in it. They don't see the need going for it because they think that what the government was more interested was the money and not the health of the people. People built COVID-19 centers in stadia that were never used, and they spent several billions of francs CFA for things that have been actually be dismantled because Cameroon is going to be hosting the next the 2021 African Cup of Nations. But these were COVID-19 centers that were set up in Cameroon that has never been used. Several billions have been used for it. And if you see, the buildings have been constructed from the COVID-19 fund. So this has made it in such a way that people don't believe that COVID exists. And last week, the government launched an intensive vaccination campaign encouraging citizens. It is voluntary for them to go and take the vaccine, but people don't still see the need of taking the vaccine.
Okay, Isidore, we lost him again, but Justice, almost everything that Isidore has been talking about should sound super familiar to you. Skepticism of the government, the questioning about where the money is going. You did your report for ACRP on how years of underfunding the health sector impacted Nigeria's response to COVID-19. And that must have been the same kind of skepticism that's saying that the money is not going to help people, but it's going into to leaders' pockets, and that kind of skepticism. Talk to us about some of the findings you had from your report.
Okay, thank you. My report focused on poor funding from 2012 to 2018 and how it affected Nigeria's response to COVID. Basically, we found out that in Nigeria, funding is a very big issue. Now, we found out that it's not just about funding, it's not just about the budgetary allocation to healthcare, but how much is released. Now, I found out that in some years, the government would budget a certain amount and not up to half of that amount will be released. Where is this money going to? And now when you even go to the field to look at some of the projects, you find out that they're nothing to write home about. I looked at one particular project in Lagos. Lagos is the commercial epicenter of Nigeria. Like, that project was abandoned. I'm sure it's still being abandoned right now. It's been there for more than 10 years. More than 10 years. And money had been budgeted for this project. When we reached out to the guys, they refused to comment. So budgeting and releasing of the budgeted amount, it's a very big issue in Nigeria. It's even what my colleague from Cameroon was talking about. Here in Nigeria, when you talk to people about COVID, they will tell you that it is my friend calls it a vehicle to cut away money from the people. Yeah, like the government will budget a certain amount for this particular thing. You find out what the amount they budgeted for a particular thing is way beyond what ordinarily should have been budgeted for. So that's one of the problems we have here. People don't believe, right? Even in this town where I am right now, Ibadan, some people don't even believe that COVID is real. If you ask them, they will tell you it is the government that brought this up, and they just want to use it to siphon funds. That is a very huge problem. And it's also leading to people's refusal to take the vaccine.
Yeah.
I have okay.
Yeah. Oh, go ahead.
Okay, I have met some people who told me that they are not going to take the vaccines because the government is not even sincere about the whole process.
Yeah. And that's not just in Nigeria. That's, I mean, literally the same type of arguments that we hear in the United States, where only half the population is vaccinated, and they have the same skepticism of the government. Lilian, I hope you're still with us, because I'd like to come to you about your report on Mombasa County. Whereas both Isidore and Justice had a more negative look, your report on Mombasa County that you did for ACRP was a little more upbeat. Talk to us about what you did.
Yes, mine was about, I focused on how the county government is, the county government of Mombasa is doing to fight COVID-19. When the first case of corona in March 2020, during that time, measures were put in place in Kenya to contain the spread. And I came up with this story idea after going through social media platform and how the county governments, what they are doing to make sure that their people are safe, their electorate are safe from getting COVID-19. And it was so amazing that the governor of Mombasa County, who is Governor Joho, he was doing so much as the government had not given out the funds for the county governments to be able to put in place certain measures or to put in place certain facilities to make sure that their people are safe from this coronavirus. He took that initiative by himself to talk to his electorate, to talk to the people that he leads, to talk to the partners, the business people, to come together to raise some funds. And from there, he made sure that the people are safe from this. And that time, there were only 17 cases in Mombasa County, and the cases were high as per that time compared to other counties. And from the social platforms, the people were so amazed. Even other counties, they were like, we will want our governors, our leaders to be like this leader, because he has taken that initiative to make sure that the people are safe, the people, their facilities, because he made sure that he got those business partners, be it, he did mention if it was from China, but from India, he mentioned that. So he made sure that they equipped the public medical facilities with the required equipment, just in case the cases rise, so that when the people go there, they have the medical attention they need. The beaches were closed because, you know, Mombasa, when you come to Kenya and you don't visit Mombasa, that is where we say here raha, yani enjoyment is in Mombasa. And with social distance, then it means the beaches were to be closed. He made sure that everything is paralyzed, and the people really heard him, listened to him, and they were so cooperative in the manner that it really helped. Up to this moment, when we are speaking now, actually in Mombasa, the cases are minimal, because the facilities are there. He made sure that spraying booths, water tanks, attached hand washing tubs, sample taking is taking place in Mombasa. And that is the story I did. Up to now, when you come now to the western part of Kenya, where I am now, actually we are having curfew time at 7 p.m. 7 p.m. East African time. Yes, here in the western part, Kisumu County, you cannot go there. We cannot travel or have meetings in Kisumu County because they have locked. We cannot travel to anywhere because the cases are rising, because our leaders were not so much prepared. Like this one leader who was so much prepared, and he involved the people to make sure that they fight this virus. He involved the people, the business people, be it Mama Mboga, be it the person at the low level. They were able to contribute what they can to make sure that together they are able to fight the COVID-19. And by the way, at this moment, it's on the minimum. People are traveling there. Unlike us in the western part, people have decided to continue living their lives as normal. Okay. They are forgetting that this thing is real. Yes, that is the story.
It's nice to be an upbeat story because we haven't had too many of those. I've got a couple questions before we go. We're going to wrap this up pretty quickly. So if you guys can keep your answers short, that would be great. Isidore, there's a question for you from the audience that says, was it extremely dangerous doing reporting in Cameroon's prisons during a pandemic? What was it like, and how dangerous was it for you?
It was very dangerous because first access was very limited. It could only give you access to as just by the superintendent. At times too, they had given them firm instructions that all visits to prisons were actually outlawed about it. But we have people, I had to create connections in the prison at times. I visited these people and I told them the need for them to be able to give information, because this information could actually help to diffuse the kind of tension that they had in one of the VIP's prison we have, like in Yaoundé, where the inmate had to go on a rampage, and they wounded a lot of former ministers who are being held in that detention facilities. And it really became a cause for concern. So most of the prisons out of the political capital that I visited, I gave them the opportunity that this is a time for you to tell your story. Because whatever happens to this prison, they will not look at the government, they will look at those managing these prisons. And at times, most of the officials who spoke to me actually spoke on conditions of anonymity. You won't accuse another person that it was a superintendent, or it was a person next to him, or it was his immediate subordinate that gave me the information, which I think I did protect them very closely in my report. And I'm happy that they were able to give me this information. And the few who talked to me, I'm really grateful, because they revealed a lot about our prisons and why there is need for it not to be looked at as not to be looked at as only punitive centers, but as corrective centers too.
Okay, well, that's very interesting. And thank you for the audience for asking that question. Nina, very quickly, before we wrap up, I'd like to come to you with another question from the audience. Do you feel that you're putting yourself at risk of catching COVID by being a reporter who goes out and meets people in the community and whatnot? Are you afraid of becoming sick just by virtue of your job?
Yes, I'm a human being, so it's just normal. So we all fear, we all have the fear of dying. So it is normal that when I go to meet some people in the community, I get scared of getting COVID. Even if I wear mask, as you know, some scientists say that wearing a mask is not effective. but we keep wearing a mask anyway. And as just like Isidore said, it is really risky. You know, you are a journalist, you have to write a story, you have to survive. That's our life. That's where we get our daily bread. It's just by writing stories or by going in the field and get some stories for some publications or for some media outlets. Yes, it's super. Here in Lubumbashi, in Congo, the first wave was taken really seriously because people were fearing of dying. I mean, people took it really seriously, like COVID comes from China. If it killed people in China, if it's killed people in Italy, if it's killed people in France, then it will just finish us here in Africa. So people were thinking about that when the first wave started in Congo. But since the second wave starts, the third wave, people now see as if COVID was like malaria, typhoid, and other diseases that we live, with them here in Africa. So they're like, if I get COVID, I will just get some traditional medicine and I will get healed. I got sick while I was writing the story while I was doing my work field, this story of China partnership with Congo. I got sick and I even had a week without working. I don't want to talk about this chapter of my life for some personal reasons, but yes, we are exposed when you go in the field, when you are on the ground. We are all exposed when you are working. So yeah, our work is really, really, really risky. But dear student, don't get afraid. That's life.
Good. Yes. Okay. Well, on that note, because I want to make sure that we end under an hour, because I am convinced that nobody watches webinars for more than an hour. I'd like for each of you, because as Nina pointed out, we want to talk to students. So I'd like each of you to leave us with one piece of advice, of really practical advice that you would give to a student journalist about how to report in the COVID era, because COVID-19 is not going to be something that goes away in 3 months, in 6 months, in 9 months, in 3 years or 5 years or 6 years. I think it's going to be one of these things that's with us for a very, very long time. So, and you're where I am in Southeast Asia, we don't have any vaccines. You don't have any vaccines. So we're going to be the last to be vaccinated in the world. So with that in mind, can you, each of you, give us and give students a practical recommendation or a piece of advice on how to report in the COVID era? We're going to start with Justice, and then that'll be our farewell to each of you with your piece of advice. Justice, go ahead.
Okay, please take care of your health, primarily.
Yes.
That's number one. Then please network among your fellow journalists. Like, get in touch with fellow journalists. They will really help you. And then keep persistent. Don't give up. Don't give up.
There we go. That was 3 pieces of great advice. 3. There we go. Isidore, what's your 1, 2, or 3 pieces of wisdom that you would like to share with young journalists?
First, I would like to tell them to be very passionate about what they're doing, especially in the COVID-19 era. What can only make you to get the story is the passion, because there is a lot of misinformation about it, and you can only be daring to be able to get the information. But first, you can only get the information when you are healthy. So I would advise them to observe the barrier measures that have been put in place, wearing a face mask, experiencing social distancing, and of course, using hand sanitizer when you have gone through or touch equipment or talk to so many people. It is very important. And what I want to tell them is that I also tell students who come for internship that one of the virtues they need to cultivate is for them to be humble. Be humble and positively aggressive. Like Justice said, never give up, because if you are not others who are always willing to withhold information and they'll just say, okay, go, we don't have this information. But when you are positively aggressive without being unnecessary or without being rude, they're positively aggressive, you cause them to give out this information that if I don't give this girl or this boy this information, I will not have rest. But I think that since they have taken journalism as the passion and their profession, they should be very, very humble. I think that is what defines me: humility and, of course, a good character.
Man, this is just amazing advice. Let's go to Lilian. What is your farewell piece of wisdom for students?
Okay, in this COVID era, measures put in place to be adhered to: hand wash, sanitize. Where you must go, make sure you have your sanitizer, have your mask on, keep social distance. If it's not a must, then get contacts so that you can call, network. As a journalist, be aggressive, be a go-getter to get that story. What else? Research, fact check. They say journalists who don't love reading, but I'm telling you, reading is good for you to be able to get information to do your story. Read, fact check, and everything will be superb. Thank you.
That is wonderful advice. I always like to say, I mean, you and I, we say the same thing, that an athlete, LeBron James, trains 2 to 3, 4 hours a day to be the best at what he does. And we as journalists, our training is reading, because if you don't read, you have none of the context to understand the stories. And how can we as journalists be entrusted to tell other people what's going on if we ourselves don't know what's going on? So I love that advice about reading. Unfortunately, too many young people don't take it, but it's also one of the things that if you read a lot, you will be better spoken, more articulate. So when you sit down for job interviews, when you write your stories, you'll just be better. So reading is life for a journalist. Nina, you're going to get the last word today. What's your piece of wisdom and advice for students in the COVID-19 era?
Okay, based on my experience, and I learned a lot during this COVID era, like how to do interviews. It is true that with the new normal brought by coronavirus, we adopted the new way of working from home, or way of the lockdown. You do interviews from home, you send emails, you call your sources on the phone, but physical interviews remain the best one, because when you are in front of your your source, you can ask any questions you want, and he will not mislead you just the way they do sometimes. Because when you call someone on the phone, he can hang up on you or not. He can block you or not. But when you are with someone physically, when you talk to someone face to face, you get to ask any questions that you want. So physical questions is very, very important. But when you are in an office, put your microphone on the table, on the desk, and respect their barrier measures. But also, you must also be consistent. Don't get tired. If they shut the door for you, no, just be consistent. Try to find the real data. It is really important. With COVID, things change every minute, every day. By the time you submit your story to the editor, that there is these statistics, like there is 3 days, from coronavirus. By tomorrow, things change suddenly. So you must really be updated. You must really be informed every minute, every day. When you miss an information, you can mislead the whole population. So please be updated, be consistent, and never give up.
So we heard: be passionate, read, be determined, be humble, be informed, be brave. These are all the things that make for a great journalist. I have to say that I've been hosting these discussions now for a couple of years now. I used to do it in person in Johannesburg with ACRP. Now we're doing them virtually. But this past hour has truly been inspiring for me. You guys are truly amazing. Thank you so much for sharing your experiences and your time with us. Isidore, Justice, Lilian, and Nina, we really appreciate your insights, and I think they're very valuable for students. By the way, everybody, the Africa-China Reporting Project has a dedicated training website that's up at africachinatraining.com just for journalists. Many of the insights that you've heard today from the panel are available also on that website. So I'd like to thank our panelists for their time and their insights, and also the Africa-China Reporting Project for allowing me this stage. And again, if you'd like to follow the work that we do at the China Africa Project, you can go to chinaafricaproject.com and you can follow me on Twitter, and I'm available anytime for any questions and comments. So thank you all, and we really appreciate your time. Have a good day. Bye.
Bye-bye.
Bye.